Hello, our aspiring consultants. Hope you all are well and welcome to the brand new episode of Strategy Unplugged. This week, I, Kushagra, would be discussing with Pragati in detail about the testing strategies deployed during this pandemic. I would like to thank Pragati for taking out time to discuss the effectiveness and agility of the different strategies used by the government. Hi, Pragati.
Hi Kushagra, how are you?
I am fine, but these times are testing. I planned a bunch of things, but this pandemic, it seems eternal.
I understand. When do you think is it going to end or at least slow down?
I would rather not predict anything as this virus has left us all in a lurch. So, let's break this down logically and find out what is the best way to tackle the situation. So, how do you think, Pragati, the government is handling the situation with testing as a tool?
Yes, Kushagra. Early on, India has discarded the WHO's advice to emphasize testing to contain the spread, deciding instead to go with ICMR's prescription of isolation. But the tide changed as on 1st May. It was seen that 74,600 tests were done, and within the next 20 days, an increase of 150% in testing was witnessed. India planned to step up testing to 10 lakh a day, and on 15th September, the number crossed 11.3 lakh. So Kushagra, I know that you love Delhi and you must have some good insights about Delhi. Has Delhi's model of testing worked?
So, talking about Delhi, Delhi has been a proactive state with the advent of COVID 19. Initially, Delhi was one of the largest contributors to COVID 19 cases in the country, but it witnessed a drastic decline in the number of active cases soon after. What worked for them? I would say their testing strategy. Their testing strategy changed from testing 5,000 a day to approximately 20,000 a day with the help of tools such as RT-PCR, rapid antigen test, and TrueNAT. Although the accuracy of rapid antigen test is low, but it is any day better to have something than nothing. Also, to add on, I would say the Delhi government started an experimental trial of plasma therapy and also set up a plasma bank so that the patients could easily access plasma. The authorities also conducted 2 serological surveys to understand the extent and prevalence of the disease through the population.
You summarized it well, but my concern is the rising number of positive cases in Delhi from 1,000 to 4,000 a day. What's your take on it?
So, Pragati, I would not treat it as a concern, as it has a logic behind it. Delhi was testing around 20,000 per day to get a figure of 1,200 positive cases daily. But then they ramped up their daily testing to 60,000 a day and therefore witnessed an increase to 4,000 positive cases. The only thing that worries me is the inconsistency in testing, especially on weekends, where the testing drops to 50% than normal.
Yes, Kushagra, that makes sense. I was reading about the testing in West Bengal. With an enormous population of over 9 crores, its testing capacity is below 25,000 cases per day. In fact, according to the Union Health Ministry, the state is figured in the bottom 5 states in terms of testing per day. It has over 1.5 lakh cases with such low testing.
Yes, I would agree. I read that too. So, what do you think should be the way forward in terms of strategies to tackle the pandemic?
So, according to me, the way ahead for developing nations like India is to re-strategize their healthcare delivery and make it more robust. The availability of proper healthcare facilities in rural areas should be the prime focus as the major population of the country resides there. There is also need to have a pandemic fund that can support people financially in their hard times. Hygiene and sanitization are other aspects that India must focus on, even post-COVID.
Well said, Pragati. I hope this pandemic comes to an end soon, with all the states being more agile in adapting effective strategies from different states. Thank you so much, Pragati, for taking out time from your busy schedule to discuss an important topic and showing our listeners the silver lining in these difficult times.
Thank you, Kushagra, for inviting me. It was insightful talking to you.
So, thank you guys for being diligent listeners. With that, we wrap up the episode and hope to see you in the next episode. Till then, stay healthy and stay safe.